Hi, and welcome to the show. Subscribe at kevinmd.com/podcast. Today, we welcome back Drew Remignanti. He's an emergency physician. Today's Kevin MD article is A World Without Vaccines, What History Teaches Us About Public Health. Drew, welcome back to the show.
Thanks a lot for having me, Kevin. I appreciate it.
All right, so tell us what inspired you to write about this article, and then tell us about the article itself.
Well, I wrote the article because I had the couple of unique experiences. One was I was in my fourth year of medical school when they made the announcement, the World Health Organization made the announcement that the smallpox virus had been eliminated from the face of the planet. And my reaction was, wait, what? Eliminated? Gone? We learned about smallpox in medical school, but we never saw any cases because it was effectively eliminated from the United States. I think 1949 was the last case in the US. So it was a historical disease, but we knew it was prevalent throughout the world. But that just stunned me, the idea that they had actually eliminated a disease from existence. And then a little bit later in life, and after I graduated in 1980, but it was in the early 90s when during my emergency medicine career, I ran into a young woman who worked for a physician who worked for Centers for Disease Control, and she told me about the fact that they now had a program in place to try to eliminate polio in the same way that smallpox had been vaccinated. And I thought, wow, I'd like to be part of that because it's such a historical success, the elimination of smallpox. I have a chance to be part of this now in relationship to polio. So that's what got me interested in vaccination and infectious disease elimination by way of vaccination.
So you're an emergency physician. Tell us about your experience with vaccines and how you got involved with vaccines, and give some context certainly about how your experience contributed to the eradication of some of these diseases.
What we saw on a more day-to-day basis in the emergency department, when we saw young children with fever, we always worried about, could this be an episode of meningitis? And the Hib meningitis, Haemophilus influenza type B meningitis, was a very common form of meningitis then. And that's been nearly eliminated by the influenza type B vaccine success. The thing that really appealed to me about vaccine preventable diseases was you could get perfect equity. I mean, when smallpox was eliminated from the face of the planet, everybody's risk for smallpox all of a sudden became zero.
Mm-hmm.
And if you could do an intervention early in life to make somebody no longer susceptible to infectious disease, and if you could do that throughout the world, that had great appeal to me.
Now, you've also had experience volunteering with the CDC and the World Health Organization as well, right?
Polio transmission was eliminated in the United States in 1970, I think it was.
Mm-hmm.
I mean, when people who were unvaccinated or not completely vaccinated against polio could become infected if it was reintroduced, as we're experiencing right now with measles in the US. But to have the opportunity to eliminate, if you really want to eliminate, if you want to bring the risks down to zero, you have to eliminate the virus from the face of the planet, as was successfully done with smallpox. And that was achieved by smallpox. We were on the verge of achieving that with polio. It was one of the things I learned when I became involved with the CDC, WHO program to eradicate smallpox,
So tell
to
us a little bit more
eradicate
about
polio.
those experiences. What did you do during those
Well,
stints with the CDC and
what
WHO?
I found that through the CDC, you could volunteer with the international effort to eliminate polio. And in the summer of 2000, I went to Pakistan as part of the program there because at that point, there were fewer and fewer countries in which polio existed any longer. It's down to just now Pakistan and Afghanistan. There's some socio-political reasons why that's true. The Muslim clerics were telling people in those countries that the polio eradication effort was an effort to, in fact, create sterility among their young women so that they could not have babies and Muslims could no longer reproduce. Kind of a far-fetched theory that somehow vaccinating a child against polio as an infant would prevent her from being able to achieve motherhood later in life. But people believe things if it's floated as a possibility and they don't have the education and knowledge to refute that, or people who can help them to refute that. They get scared
Mm-hmm.
basically, which is what's going on in the US now. People are afraid of the MMR vaccine, you know, at the potential risk of autism, which has been disproved again and again and again.
what's your thoughts about what you're seeing now in the United States? I think I just read an article that the outbreak of measles in the United States, it's just been growing, and certainly it goes without saying that the administration has been sowing distrust in vaccines. So as you're seeing what's going on now, and you put that in context with your prior vaccine experience, what's going through your mind as you're reading the headlines today?
Well, it's ironic because we're a highly educated population compared to the East South Asia population in Afghanistan and Pakistan. Most people go to school, they get educated, we have access to good information. We are trained to become critical thinkers to some degree. But it's interesting that it shows how susceptible even an educated population like the US is to people who want to undermine confidence in healthcare, which unfortunately seems to be one of the goals of our Health and Human Services Secretary. Even our current presidential administration seems to want to undermine expertise.
What are some of the reasons behind that? Why do you think that, like you said, a society as educated as we are here in the United States, why are we so susceptible to misinformation and narratives against science and vaccines?
Well, I think it's inevitable when there's uncertainty, and science is based on the idea of trying to reduce the degree of uncertainty. But we face that every day in medicine, practicing medicine. Somebody comes in with a set of symptoms. You're uncertain whether it represents something serious or something minor. And then you do the testing to put yourself in one direction or the other. Most people who are ill as patients have not gone through a rigorous training process to weigh evidence, pros and cons, and so they rely on what they hear through the media. And unfortunately, they often will allow their choices that should be scientifically based to be influenced by socio-political considerations. Do I like that person? Do I like their political beliefs? Do I like that social group? It's unfortunate, but that's what we're prone to as human beings.
Now, do you see any historical parallels to what we're seeing now when it comes to that distrust in public health? Has this happened before in history?
Well, I think it's not all that different from what we saw going on in Pakistan and Afghanistan, which is you had people in power, the Muslim clerics saying to people, look, this is an underhanded Western effort to cause infertility in our young women, and we should avoid it for that reason. I frankly can't wrap my brain around why educated people like our president and our Secretary of Health and Human Services, I don't really know what they get out of it personally, except for self-aggrandizement.
So, in terms of what's happening in Afghanistan and Pakistan, because of that distrust in vaccines, you said there's been outbreaks on conditions that's been eradicated in other parts of the world, right?
Those are the two countries in the world that if we succeeded in eradicating polio from Afghanistan and Pakistan, we would have worldwide polio elimination, eradication, and we could stop immunizing against polio, just like we've stopped immunizing against smallpox. And we could do the same thing for measles if we committed ourselves to it. As this current outbreak is showing us, there are pockets of unimmunized children, and then you let measles virus loose in the U.S. as it happened most recently. It began in West Texas, and it basically spread to, so I think 41 out of the 50 states have had measles outbreaks. I just heard this morning on the news that there's an outbreak going on in New York City. If there's a susceptible, unimmunized population of children who are susceptible and unimmunized to measles, measles will find them and will
Hmm.
cause serious illness and some potentially even death.
Now, you're obviously an emergency physician and an author, and I'm sure that you talk to a lot of people, both in the clinical setting and outside. Have you had personal experience with people who have been a little bit suspicious of vaccines and public health? And if so, how do you normally respond or persuade or interact with people who have that inherent distrust of the healthcare system?
Well, typically that doesn't come up in regards to immunizations in the emergency department. When I see people in the emergency department, most often they're there, they want a vaccine. They stepped on a nail, they want to get a tetanus vaccine. They had a bad exposure, they want to get rabies immunization. So it's a little bit different patient population we see in the emergency department. I would advise those people who have become skeptical about the utility of vaccines to have that conversation and relationship with a physician you trust, ideally the pediatrician to your children. I think that's the only way we're going to get beyond this is to have that degree of trust in your pediatrician to guide you to make wise science-based decisions regarding how to immunize your children, how and when to do that.
So let's talk about trust in our healthcare system. And I think during the pandemic, we've lost a lot of trust, frankly, in our public health system, right? So how do we get that trust back just from a population and society level when it seems we've lost so much of it, especially during the pandemic these last few years? How do we get that trust back?
It's a huge barrier, and I think the only way it can be done is on a one-on-one basis. I mean, if you happen to have a pediatrician who's anti-vaccine, you need to say to that person, why are you so anti-vaccine when the bulk of your trained colleagues are pro-vaccine? And it has to be done on a one-on-one basis. It can't be done on a political basis. I want to, be consistent with my political party.
So what do you see as the path going forward? Again, drawing from historical parallels, what's happening in Pakistan and Afghanistan? Has there been any movement in terms of gaining the population's trust for polio vaccine? What are some historical paths forward?
I don't know that there is a complete parallel with there. Well, I did meet people when I became involved with the polio eradication effort. I met some people who were involved with the smallpox eradication effort. They were still around, some of them, and they said they sometimes met great resistance in the same way people would hide their smallpox infected relatives from the investigators and the vaccinators. It's fear, ignorant fear is usually based in incomplete information. When you get as complete a set of information you can about something, you can reduce your fear. And that's what we should be expecting from our government and from our Health and Human Services Secretary, who currently is all over the map in terms of, let's use the measles example. He said things that just aren't internally consistent. Our RFK Jr., our IHHS secretary, has said that when he was faced with this decision as a parent, he got all of his children vaccinated. But now for some reason, he's claiming he regrets that he had that done. He has said that the solution to the current measles outbreak is to get vaccinated. And then at the other side of the mouth, he says there's no vaccines that are safe and effective. So when you get that kind of contradictory information coming from the same individual, you're not going to get a chance to ask him in person, obviously. So I think that you need to set aside that source of information as just not internally consistent any longer and get in a more internally consistent set of answers from, we're lucky in this country, we can access individual physicians without restriction for the most part, which they can't do in Pakistan and Afghanistan as readily.
So I think one of the issues is that a lot of societies simply don't know what it's like when there were smallpox, polio, measles outbreak because it has mostly been eradicated. People generally don't know what it's like to have a smallpox outbreak, for instance. So, from your experience and what you learned, what was it like before smallpox was eradicated, before polio was mostly eradicated? What was it like before vaccines?
Well, that's what the main thing that motivated me to write the article we're referring to, and I included some images that are kind of eye-opening. Rooms full of iron lungs with children who were polio afflicted, who could no longer breathe on their own, and that startling image of the two boys side by side, one who has diffuse smallpox and one who was vaccinated and has no smallpox. I saw polio cases when I was in Pakistan, but again, even since I graduated medical school in 1980, we weren't seeing routine transmission of polio in the US, and hopefully we will never see that again. We certainly weren't seeing routine transmission of smallpox because it was eradicated. We weren't even seeing routine transmission of measles, but now practicing physicians need to know how to recognize measles. And you probably never saw a case of measles, I'm guessing, did you,
I
Kevin?
haven't, no. How about yourself in the emergency department? Have you ever seen a
Never,
case of
never
measles or
did.
smallpox or anything like that?
No, in Pakistan, I did see a couple of kids who were recovering from measles just at a refugee camp along the Afghanistan border. That was my only exposure. But the numbers speak for themselves, the number of cases and deaths from preventable diseases like measles and polio and certainly smallpox. You know, I don't, the people who are anti-vax or vaccine skeptics, I wish it could be put on the spot and say, well, how do you explain this? How do you
Hmm.
explain the disappearance of smallpox if there are no vaccines that are safe and effective? How do you explain the precipitous drop in measles cases and polio cases and the fact that we are on the verge of eradicating polio from the planet if vaccines are not effective?
Is that how you would engage vaccine skeptics if you were to have a conversation with them? Would you ask them those specific questions?
Yeah, I would ask them to take a look at the data that I put in my article and say, well, how do you explain that then? One of the explanations that people have come up with is, gee, those were just improvements in hygiene and development in the country. And those things, as we got to be a richer, more hygienic country, we were able to prevent disease spread on that basis. What's interesting is that when polio first became an epidemic disease, it became an epidemic disease in the most highly developed countries in the world at that time, the Scandinavian countries, where the first polio outbreaks came. And it was felt that that was due to the fact that they had progressed hygienically to the point where they had clean water supplies. Because the way the polio virus acts is that if you're exposed to it as a young infant and you have maternal antibodies still from birth, you're not going to get the disease. But when you have such good hygiene that you're not exposed to circulating polio virus in your water supply, like was true in the Scandinavian countries, you don't get exposed to the virus until later in life when your maternal antibodies have disappeared. And now you're susceptible to the polio virus infection.
Hmm.
So improved hygiene actually caused the initial polio epidemic outbreaks. So the hygiene hypothesis that infectious diseases are disappearing because we're just getting more hygienic, it just doesn't hold water if you look at it in a hard science fashion.
We're talking to Drew Remignanti. He's an emergency physician. Today's Kevin MD article is A World Without Vaccines, What History Teaches Us About Public Health. Drew, let's end with some take-home messages that you want to leave with the Kevin MD audience.
Again, the title of my book is The Healing Connection, a partnership for your health, a partnership for your health. I think the best thing we can do for ourselves health-wise is to choose a primary care physician who we can put our trust in because you cannot, unless you want to go to medical school and become fully educated as a physician yourself, you can't have that full knowledge. And even myself, as a fully trained, experienced physician, when I have problems, as they have had personal health problems with that are gastrointestinal or whatever, I go to see a specialist who knows even more than I do. So when it comes to our health, you need to see somebody who knows more than you do and ideally someone who's trained in modern science-based healthcare and form a partnership, trusting partnership with that person and move forward. It doesn't mean you can't question what they tell you, but you need to have a source of information that's free of political or bias.
Drew, thank you so much for sharing your perspective and insight. Thanks again for coming back on the show.
Oh, Kevin, thanks so much for having me on again, Kevin. I really appreciate it. I hope people do seek out a primary care relationship for themselves and their children.